name is Yumi Ridsdale. I am a registered acupuncturist and Chinese herb practitioner. So today I'd like to talk about bowel movement and stool. I always ask about what kind of poop you have, and I ask about the shape, I ask about the smell, I ask about the frequency, I ask about the amount, and then some people say that it's just normal poop, you know, they don't want to talk about it, but I really don't know your normal. Your normal could be like, you know, 3 times a week. Your normal poop could be, I don't know, mashed potato like stool, right? So today I would like to talk about in general what kind of poop we are looking for. So ideal poop is nice and smooth, long, one piece, which comes out effortlessly, slides out without pushing too hard. It shouldn't have a strong odor. It's not smelly. Any poop have some smell, but it shouldn't be wowza odorous, right? And then you should feel good. You should feel good after defecation. You shouldn't feel yucky or incompleted. So this is ideal poop. It should be once a day, every day. Maybe twice. That twice I may not concern too much. Ideally once, but the twice I may say, okay. 3-4 times, yeah, I may concern that. Ideally in the morning, you should defecate in the morning. Some people defecate before they go to bed. That's a Qi deficiency. Yeah, so in the morning, once a day, every day. You may say, oh, I only go to every other day, and it's always been like that, always. Then you just have a weak intestine for, like, you know, all the time, right? So it should be every day, once a day. It shouldn't be 3-4 times. Okay. You shouldn't be too loose. Good poop, if you try to pick it up and it should be pickable, you know. If you feel like it's formed but loose, so it may fall apart when you picked it up, that's too loose. It shouldn't be mashed. It shouldn't be puddle. It should have a log-like shape. So if it's like slime-like a shape, there's pathogens in your intestine, right? Definitely no diarrhea. Diarrhea shouldn't happen like at all. I have a family members who only have a diarrhea or a loose stool. That's wrong, right? They should correct that. Liquid diarrhea, definitely not. That means that your intestine cannot absorb anything. And I will ask if it's a explosive, strong shooting out type of the diarrhea, or it's a kind that it dribbles out. It changed the diagnosis. With smell or without smell, change the diagnosis, so that you shouldn't have a diarrhea at all. Also undigested food, right? You shouldn't have any undigested food in your stool. If you have undigested food, not just the intestine, but your stomach is not working, probably it's too cold. So you should never see undigested food. If you see lettuce, then you shouldn't eat lettuce. You can't digest it. Corn's okay. Human being is not meant to digest corn. So seeing corn is okay, but other than that, you shouldn't see any undigested food. Also, it shouldn't be too hard. Lumps, you shouldn't see a bunch of lumps, or it's a one piece, but it looks like a lumps put together. Those stool is too hard. Also, if the stool looks like a dry and hard, that means your intestine is too dry. So we need to correct that. We need to moisten the intestine. So it shouldn't be too hard. You shouldn't have to push really hard to defecate. It should nicely slice out without any effort. It shouldn't be painful. The clamps or in the lower abdomen, or the pain at the anus to push it out, the hard stool, it shouldn't happen, right? Like I said, it should naturally slice out without effort. Also, you shouldn't feel incompleted. Once you defecate, you should feel it's done, right? You shouldn't feel fatigued after the bowel movement. That means you're too weak. As in the whole body, you have a qi deficiency if the defecation taxes you so much. Also, you shouldn't feel itchy. Itchy in the anus is there's a much pathogens in your intestine, so we need to take care of that. My dog does this sometimes, but you shouldn't. No, my dogs, right? So ideally, just for the review, it shouldn't be too loose, it shouldn't be too hard, it shouldn't be diarrhea. Here you go. Ideally, your poop is nice, smooth, long log, one piece, not smelly, no undigested food, no mucus, no blood, effortlessly comes out, and then you should feel good after the defecation. That's a good bowel movement that we're looking for. It shouldn't take much toilet paper to clean yourself. Like you shouldn't need like half of the toilet paper roll, right? It should be easy to clean yourself, and when you flush the toilet, it shouldn't leave any mark. Like it should just flush it away. Some people ask me about this floating poop or sank poop. I don't really care personally. There might be a meaning, but I don't really care. I'm much more interested in the frequency, shape, odor or no odor. Yeah, that kind of thing. Okay, so these are the poops that the acupuncturist like. Thank you very much. It was Yumi Ridsdale from Trium Chinese Medicine about your poop. Bye-bye.